The people we love are often our greatest source of distress, aren't they? One question I think you should ask yourself is, first, a very practical one. Are your family members actually taking safety precautions seriously? They don't have to be perfect, but are they making efforts to minimize risk? If they're not, and if that's a big part of why you're anxious around them, then this has to be discussed, as your fears may be justified. But if that's not the problem, then you want to check if you're unintentionally feeding the anxiety by focusing excessively on risks around you, which is an understandable mistake to make at a time like this. So what I'd suggest is try to make sure that you're balancing your heightened sense of risk with reassurances. For example, you can assure yourself that the distancing efforts that your family and others are taking dramatically reduces their risk for contamination. And although it can take 2 weeks for symptoms to emerge, the virus seems to be spreading slowly throughout the valley. No doubt, in part, due to everyone's excellent efforts that we've all been making to protect ourselves. Which means that when your family seems healthy, they probably are as healthy as they feel. So, don't just look for danger. Practice self-talk about why you shouldn't be so afraid. Make a conscious effort to balance your thinking. And over time, I think you will experience less anxiety. Keeping in mind that a low to moderate level of anxiety is appropriate and unavoidable at a time like this. Some people are saying that we're all in the same boat right now, but that's not true. We're all in the same stormy ocean, but we each have our own boat. Some of us are riding out the storm in a yacht, while others are riding it out in a leaky canoe. So however you're handling things right now is probably pretty understandable for whichever boat you're in. Personally, I've been really enjoying all the extra time I've had with my family, but other people may be chafing. When we're all stuck together without escape, the minor annoyances that we feel about each other and others feel about us is amplified, just like astronauts crammed together for months in space. So it's important to create small boundaries for privacy. Let others know that you're not to be disturbed for a couple of hours so that you can get work done or do a hobby, and then enforce that boundary if people test it. One advantage of being in a rural community is that it's pretty easy to take a walk alone outside to get a break, or else go for a drive. Another tip is to check in with your family. Ask how they're doing. Ask how you can help lighten the load. Let them know how you're really doing in a polite and loving way. And if you need it, ask for help from them. I know it might sound obvious, but you'd be surprised how often we don't do the obvious things. This may be a challenge for some people. I think the trick is to take advantage of the changes that isolation brings, instead of seeing them as burdens. For example, if you have a lot more time on your hands, either use it to do things you've been wanting to do but haven't had the time, like hobbies or home repair projects or reconnecting with old friends. Use the time to focus on parenting or family relationships that may not get enough attention when we're at work. Or alternatively, use the extra time to do nothing. Get reacquainted with experiencing life without the constant pressures for productivity, which is something that we should all probably do. Make it a priority to go to a forest when the weather is good, because research shows that being in parks and forests has a strong beneficial effect on mood. Don't watch a lot of news about the pandemic. That probably causes more stress and doesn't help much. And finally, replenish your natural capacity for resilience in the face of stress by making sure you're sleeping the right amount, eating healthy foods, avoiding alcohol and tobacco, getting some mild exercise, and talking to people, even if it's by phone or video. Yeah, this is a great question, but there isn't a one-size-fits-all answer. Hopefully by this time, most children have been adjusting on their own to the situation. I know my daughter was expressing a lot of anxiety at the beginning of the pandemic, and nothing we said was particularly reassuring to her. But now, because nothing awful has happened, she has been relaxing a lot. But kids will need extra support and attention moving forward, because their parents will be struggling with the economic consequences of this time for a long time, and because getting back into school routines and trying to catch up academically may be a real challenge for some. During the pandemic, the main goals are to provide children with age-appropriate information about what's going on that's accurate while not frightening or confusing, to highlight all the things that grown-ups and kids can do to stay safe, and finally to express confidence that whatever happens, families will help each other through it. The goal is not to protect children from reality, but to help them feel empowered and able to adapt to the challenges successfully. Because it can be tricky figuring out what to say, you may want to speak with a mental health professional who can brainstorm with you what your child needs to hear and how to say it. There are also some great online resources that you can search up about talking to kids about COVID. And remember that behaviors are just as important as words. Parents who say everything is okay but act overwhelmed are more likely to worry than reassure their kids. So it's better to be upfront with children about what you're feeling, but also show them what you're doing to try to cope so that they feel informed and reassured. So psychologists are doing a lot, and will be doing a lot. They're educating the public about healthy coping through media outlets. In Washington, D.C., they're advocating for legislation that will help assist people psychologically, and for changes in regulations to make mental health services easier to access during the crisis. Research psychologists will be studying how people respond during this time to help us to do a better job coping in the case of future pandemics. Clinicians, like myself, are meeting with patients online and continuing to help people deal with pre-existing mental health problems, as well as dealing with any pandemic-related stressors. Psychologists are the best trained behavioral and emotional health experts in the country. But I really would encourage people to reach out to any licensed mental health professional to talk one-on-one about problems you're having, because general advice can only take you so far. You may not feel like the advice you're getting from experts is relevant to you or adequate for your situation. It's just like the difference between watching a workout video and getting one-on-one feedback from a trainer. I can't guarantee that psychologists can solve your problem. Some problems don't have a solution. But we can talk about adapting to challenges, and sometimes it feels helpful just to talk to someone who cares and is a good listener.